Hello, everybody. James Anthony here, Dean of the Graduate Division at UC San Diego. Thanks for joining us this morning for the Graduate and Professional Student webinar. We hope to spend an hour with everybody who is in this session. We have several wonderful panelists who are going to speak about a variety of issues that are important in the present moment of the coronavirus and COVID crisis. We hope that you will find all of this very informational. As we go through the slides here, the presenter will ask for the slide to advance. Please know that this session is going to be recorded. We are now recording. And so if you miss anything, we will post this recording so that you can go back and look at it at your leisure. So we're going to go ahead and advance to our first slide here. And I want to just say that we are co-hosting this, the Dean of the Graduate Division's office, Allison Satterlin, the Vice Chancellor of Student Affairs, and Rachel Flanagan, the President of the Graduate Student Association. We're very thankful to this group of people, obviously, for having the idea of doing this webinar. And through this group of people, we've invited the remainder of the panelists who you will meet as we go through the slides. Okay, we'll go to the next slide. I'd first like to introduce Drs. Sosha and Dr. Schooley, who are going to help us understand about COVID-19 and the overall public health picture. I'm going to turn it over to them.
Let's go to the next slide.
Can we have the next slide, please? So this is Dr. Schooley. I'm going to spend a couple of minutes trying to lay a little bit of groundwork from the scientific perspective, and then we'll talk a bit about the Student Health Service and its services with Dr. Sosha leading that part of the conversation. First thing I want to point out is that there are a large number of members of the coronavirus family that have been circulating for hundreds of years in the human population. The ones shown for you in the red box up there have been around for many, many years, and generally just cause cold symptoms that we see every winter that tend to go away without any problem. 3 of the last 4 at the bottom of the list here that are in bold are ones that have emerged into the human population more recently and for which we don't have good immunity. These include the SARS coronavirus that caused the outbreak in South China and Hong Kong in 2002 and 3, the MERS coronavirus, which appeared in Saudi Arabia in 2012, and the SARS coronavirus type 2, very closely related to the original SARS coronavirus that is now circulating around the world. These coronaviruses differ from the ones that we've had in the human population for a long time because we have not yet developed immunity to them, and because they tend to grow in the lungs rather than up in the nose and throat, which is where the ones that cause the common colds grow. And these are the ones we're dealing with now. Next slide. Now, we've heard a lot about the coronavirus profile. These are data from China. And the point I want to make here is that the epidemic involves people of all ages. We know more about people who are older because if you were older, you're more likely to have symptoms to get to medical attention. This is the Chinese experience in which you can see the median age of people who presented for care was in the 50s. But there are many, many more younger people who had infection without symptoms who didn't get to medical attention. The yellow line is very important, and that is the line that depicts the the distribution of people who get into trouble by age. And you can see that as you get older, the case fatality rate begins to rise substantially from the mid-50s through the 80s. And in many of these cases of the older population, these are people who also have coexisting conditions such as hypertension, asthma, and other chronic diseases. Now, this is not meant to say that younger people cannot also get into trouble with this disease, because there are younger people who become seriously ill and die. But the point I'm trying to make here is that the burden of the disease in terms of morbidity and mortality falls on the older population. Next slide. Now, in looking at how people present when they come to the doctor with symptomatic disease, about 80% of people will present with fever. That's the most common presenting finding. but only about 40 to 50% will present with a cough. So although people do cough, more than half actually will have a fever without a cough. So it should not be an indicator that without a cough, you don't have this, this disease. Many people feel tired, but you can see that a lot of the other kinds of symptoms that we see with flu are less common with this disease, like headaches and muscle aches and sore throats. They can be present, but they are not the dominant aspect of this disease. There's a lot of overlap between influenza and COVID nonetheless in an individual patient. And the only way we can tell the difference in one patient in front of us is with laboratory testing. Next slide. Now, this is a cartoon from a presentation made at a virology meeting that we were involved in about 3 weeks ago from the director of epidemiology from the Chinese CDC to lay out the typical course of the disease in China. The first point is that about 80% of people will have mild or moderate disease. These are people who have mild symptoms that last for a week to 10 days, stay home, and don't require any major medical intervention. A smaller percentage of these people, a small percentage of these people will go on to more severe disease and an even smaller percentage to death, but by and large, they recover over a week to 2 week period. A small fraction of people will have severe disease, and these are more likely people who, as I've already said, are older with pre-existing conditions, and these are the people who are more likely to get into trouble with complications of the disease. The death rate for this disease is probably in the range of about 1% in the population as a whole. Now, one thing that this slide doesn't capture is that we know now that there are a larger number of people who have disease that doesn't come to our attention medically, so-called asymptomatic infection. And these are very important because these are people who are able to spread the virus in the population without being aware they're infected themselves. And this is why all of the advice you've been getting recently about social distancing has been very important. Just isolating people who have symptoms that we know are infected will not stop this disease. The way to stop this disease, this virus, is to socially isolate ourselves for long enough for the virus to decay in our population. Next slide. I've already made this point about mild and subclinical cases being common. We don't know how often yet. It will require more testing with antibody testing in the population, which will go on over a couple of months. But I would not be surprised in younger populations in particular if this number doesn't turn out to be as high as 30%. Another point to make clear is that people begin to shed the virus 2 to 3 days before they become sick, if they're among the people who become sick. And what that means is that, again, as in the case of asymptomatic infection, people can shed the virus, spread it to other people before they know they're infected. And again, this emphasizes the need for the physical separation we've been talking about over the course of the last several weeks. Next slide. This just gives you a snapshot of where things are globally. We're at about 1 million cases globally. And the focus of the disease has now shifted from China to Europe and to the US in terms of new cases. Next slide. This just shows you where the US epidemic curve is. We were late in getting started, but our slope is quite concerning when you compare it to the slope in other parts of the world. And it rivals the slope that we've seen in places like France, Spain, and Italy in the early phases of the epidemic. And last slide for me. This just shows you the overall distribution by state. And I only want to make 2 points here. The first is that New York State, as you've been hearing, is where most of the concern is. And this is because social isolation was late to get started there. It's a very dense population. And they are in a very difficult medical situation with a number of cases that have occurred. California, as you can see down almost on the bottom of the graphs, just below the brown line between 25 and 27, is a state that so far has a relatively flatter slope. We are in the bottom 10 of new cases around the US at the current time. And we think most of this is even driven by Northern California. Things in Southern California seem to be quieter than this. And this, we think, is because when the isolation procedures were put in place 3 weeks ago, Governor Newsom did this because of activity in the northern part of the state at a time when we down south had begun to see cases, but we were not as heavily impacted as in the north. And in all of these situations, the earlier you start with social isolation, the better in terms of preventing spread. So that means right now, although we have a number of cases in the hospital, we've had deaths in Southern California, we think the overall community prevalence is lower than in other parts of the country. And by doing the things that all of you are doing, we think we can keep it that way. And then begin to see a decline over the course of the next month. And I think I'm now going to turn it over to Dr. Sosha. Angela?
Next slide, please. Good morning. The Student Health and Wellbeing Cluster has continued to provide services and developing a combination of in-person and remote services. First, I'm going to speak about directly student health services. Please note there is a nurse advice line. The phone number is 858-534-3300. I'd encourage you to put this in your phones so you have easy access if you need some help. We have nurses answering this, providing guidance. Our own team will be extending that, and we also have an after-hours team for late in the middle of the morning, like 3 a.m. But they know how to contact our team, who's always available to you. Again, if you have any of those symptoms, the fever, the cough, the shortness of breath, I'd also add fatigue, or you learn you may have been in contact with someone with COVID through a community or some other way that you find out, please call us for further advice. The open hours for student health services are posted. They're Monday through Friday, basically 8 to 4 p.m. with a little late start on Thursday where we do team huddles. We have created very clear segregation to respiratory and non-respiratory care areas. All students are triaged at entry. We have folks entering, if you do not have respiratory symptoms, please come in on Library Walk, which would be the east side, versus if you have any respiratory symptoms or COVID contact, come on the parking lot or the west side. Within the building, there is also geographic separation of the respiratory and non-respiratory care. Currently, we are trying to have primary care for essential timely visits. If things are stable, we'll open that to all primary care. And we have telemedicine visits when they are appropriate. And women's health and sports medicine is also available. Next slide. The laboratory is open, including the self-directed sexually transmitted infection testing, x-rays, as well as pharmacy. Pharmacy has also provided a nice service. They can mail prescriptions to homes off campus within the state of California, and they can extend the refills to 90-day supplies. Optometry is also mailing out contacts or replacement glasses. Right now, we don't have in-person optometry, but we're hoping if things stay calm, we will be able to add that back in. Insurance is working remotely and fully available. That staff remotely is responding. I do want to say that SHIP coverage remains intact, and that for all payers, we are seeing students regardless of what your insurance is. So SHIP, non-SHIP, private insurance, whatever your insurance, if you have a COVID-related problem, please come to Student Health. We will take care of you there. So don't let insurance be a barrier to accessing care. All right, and the email for insurance is there as well. Next slide. The CAPS team has gone to virtually remote with a lot of services being offered through video, telemental health services. It's all HIPAA compliant and very secure. It's the students who are taking advantages are really finding this to be valuable. There are group sessions as well. And urgent care on campus does remain open with a core staff. So if you have an urgent need for mental health services, please call the CAPS number 534-3755. They will guide you and bring you in for urgent care support. And again, that also has after hours calls, and there are CAPS providers available on call 24/7. So the CAPS team is fully there to support the student body. Next slide. Health Promotions has doing quite a bit and pretty much converted all of its offerings to a remote and video, lots of activity here. I'm not going to go through all of these things, and that's great. There is a question I just saw about CAPS. CAPS is provided to all students. It is regardless of insurance, and there are no charges for CAPS services. Okay, next presenter, please.
Good morning. My name is Robert Frazier, and I'm the Associate Director of Graduate Housing at Housing, Dining, Hospitality. Next slide, please. So I want to just thank the group for hosting this event, and we are very proud to have the opportunity to be a part of it. I'd like to start off by saying that Graduate and Family Housing remains operational and continues to provide housing for graduate students and families. So far, we've had 218 students who have taken advantage of the opportunity to terminate the rental agreement with less than 30 days notice. That was a program that was running in the month of March. But for those students who do remain in their apartments today, they are still required to pay rent. But HDH has a number of programs to help students if they're facing any types of financial hardships. And that includes that the students can still terminate the rental agreements if they choose to go home or house elsewhere, but that'll just require 30 days notice. And additionally, we are accepting any type of extenuating circumstances that maybe would not allow for a 30-day notice, and they should just reach out to their community office or email gradfamilyhousing@ucsd.edu. Additionally, we have a program where there will be no new late fees that will be assessed for any late rents through June. And now through the end of May, the campus does not intend at all to commence with any new unlawful detainer proceedings for non-payment of rent, so long as it meets the criteria of the governor's executive order N3720, which relates to financial hardships of the coronavirus crisis. And there's also, if there's any requests for rental deferments are for a 30-day period. In essence, you would go to our website, the Housing, Dining, Hospitality website, and submit a request to have a 30-day deferral of your rent, and then you would make that payment the following month. And then additionally, if there's any students who are experiencing any challenges related to basic needs, such as access to nutritious food, stable housing, financial wellness resources, they should contact Basic Needs at ucsd.edu or call the phone number of 858-246-2632. And then for any of the students that are coming up on the end of their lease agreements, this is not probably the best time to be moving from one house to another. So if they would like to stay in their current residence, they should go to the HDH resident portal, and there is a link that you can click on that would allow you to fill out an appeal for an extension of your lease, and those will be evaluated on a case-by-case basis for the length of term, and you'll receive an email response back. So generally speaking, the bottom line is that Housing, Dining, Hospitality is here to help graduates and their families. So if anyone has any questions or needs any assistance, they should call their local housing office or email us at gradfamilyhousing@ucsd.edu. Next slide, please. Additionally, we've had some efforts taking place in the larger community or each of the communities at large. Those activities include increased cleaning for all the public areas to comply with the social distancing guidelines. So that would include laundry rooms, postal facilities, elevators, areas where residents come and go. So those are cleaned on a much more frequent basis now to ensure that they are sanitary as possible and able to address the needs of the people who live in those facilities. Additionally, all general services are available at each of the offices, although the offices are closed, but Monday through Friday, 8 a.m. to 4 p.m. And we are accessing residents, or residents are able to access us by way of phone, email, as well as video chat. Additionally, we're working with Spectrum Communications to enhance the Wi-Fi connectivity. That's all in an effort to support the students' remote working needs. Additionally, we have worked with a number of food trucks and our coffee shop to keep their operations that are open. But again, keep in mind that is for takeout service only, but those are open Monday through Friday. Additionally, there are dining facilities on campus that will remain open. Operating hours for each of those locations vary. So I would go to the hdhhome.ucsd.edu website to get current up-to-date information. Additionally, to follow along the lines of the social distancing, we've moved many of our community programming efforts to the virtual or digital format. So I would have students keep an eye out for community flyers as well as emails being delivered to them. And they will be able to participate in group events by way of the internet and video communication. And then lastly, this is HDH, are providing support to graduate students who require isolation that's been recommended by the Student Health Services. Those students, in addition to being isolated, living alone, will also be receiving their basic needs, which includes food and any other items that they may request as far as sundry items for personal need that they'll be delivered to their door without them having to come outside of the unit. And with that, we'll hand it off to the next participant.
Okay, good morning, everybody. My name is Judy Kim. I'm the Associate Dean here at Graduate Division, and Mary Allen and I, Mary Allen is the Director of Academic Affairs. We're going to be just giving you really brief information about some of the academic implications for what's happening this quarter. So next slide, please, Tamara. So what we want to emphasize right off the bat is we all appreciate and understand this is a highly unusual quarter. We appreciate that there's a lot of stress. There's a lot of individual unique circumstances on what's going on in your lab or with your research, field research, et cetera. And we want to support all the students. To the best of our ability, knowing that this is an unusual quarter, we want things to progress as well as they can. So effective until the end of the quarter, or actually end of June 30th, you are required to take any exam, whether it's the dissertation defense, your candidacy, your qualifying, whatever exams that need to take place in your program must be done remotely, which means it's got to be a live video teleconference. And this is for everybody. So if somebody says, I'd like to meet you in person, that is not allowed. And if you're hearing these things, please let us know so we can make sure that the information is out there properly. So again, any of your exams, assessments must be done remotely until June 30th. After June 30th, we don't know what's happening, and we will provide information as soon as we have that from campus. Second part of the about the academic progression is that all doctoral members, for those of you defending your master's or your dissertation defense, all committee members are expected to participate in the exam or defense. So as you see on this slide here, it is permissible, however, for a committee member other than the chair or outside tenure member to participate in the defense ahead of the exam date. Without exception, however, both the chair and outside tenure member must be present. So what that means is if you have one or two committee members, for whatever reason, they're not able to participate, it could be technical reasons, it could be health, it could be any reason at all, you can meet with them ahead of your exam date through obviously remotely. However, the chair and the outside tenure member must be present for your remote defense. So again, we are, this is a rule or a policy that's actually relatively new, but it's in place and not just to this particular situation. But this should help, we hope, in the exam component of your academic progress. Next slide, please. And I'm going to pass this over to Mary Allen.
Good morning, everyone. So to piggyback on what Judy's talking about, everything is remote. Procedures are the same, but all of our forms are now online, and we're currently working with the campus to get faculty digital signatures. Your graduate coordinators will be facilitating you and your faculty with this process as you get ready to take your exams this quarter. There will be a remote workshop that will be held to discuss dissertation and thesis formatting. That will take place on April 15th. More information, including the Zoom meeting address, will be forthcoming in email. And as for your preliminary appointments that you will need to have for your thesis and dissertation submission with the graduate division, those will also be held remotely. And when you go to our website to schedule that appointment, it will assist you in scheduling your appointment remotely through Zoom with the proper advisor. That concludes my slide.
Thank you, everybody, so far. Now we're going to turn to some more general announcements. I'm here again, James Anthony. We have Gabrielle from the Commons, the Faculty Director of Commons, and she has one or two of her colleagues as well. Next slide. So I'm going to turn over to Gabrielle for the first couple of bullets.
Thank you very much, Jim, and good day to everyone. I wanted to ensure all of you that all services of the Teaching and Learning Commons continue to be available. I refer to our website, commons.ucsd.edu, for you to see detailed information. We, of course, continue to offer all services and programs for our graduate students, and that includes graduate students in their role as students, as well as instructional assistants and TAs. I wanted to highlight one service specifically, and that is the support that our Writing Hub provides for our graduate students. So again, please go to our website for detailed information. Just that much, all services are available remotely. And I would like now to turn over to my colleague, Erlyn Heinrichsen, to share with you more information about how we support you in your role as instructional assistants.
Hi all, thanks Gabriella. So I just wanted to let you know that we will be offering remote workshops on teaching strategies, as well as individual teaching consultations throughout spring quarter. And these are both for instructional assistants and those teaching as associate INs. Now these workshop topics and resources are being developed as we speak. So to keep up with the latest, we encourage you to sign up on the listserv that's actually linked from the website, which is on the slide there. So if you sign up for that listserv, you'll hear about things as they come out, including in the next few days, we'll actually be opening a Keep Calm and Teach On Canvas site specifically for you to ask questions and share ideas about remote teaching with your IA and TA colleagues, as well as to get support from the Teaching and Learning Commons in a more asynchronous manner. So we hope that this will be helpful for you.
I also wanted to highlight the importance that you keep track of your working hours as IAs. The current situation may indeed cause additional work, and we want to make sure work hours, and we want to make sure that we keep track of this, and so that we can support you in that matter too. Jim?
Thank you so much. And just to piggyback on that very last point, as we reinforced in a communication a couple of weeks ago about all the instructional support available at the Commons, both Vice Chancellor Sandy Brown and I encourage all students who are working in a teaching capacity this term to have open and honest dialogue with their instructors of record about the hours that they are working. If there are ever any concerns about hours or being asked to work more hours than you're contractually supposed to, we hope you will be encouraged to contact the Dean of the Graduate Division directly so that we can assist you with that conversation. I'd like to move to the remaining 3 bullets on this slide. The first is just to make sure that you are all aware that the Graduate Division has authorized all departments to use their own resources to create 2 new TA opportunities. One is a senior remote learning TA. This is an individual who would work closely with the faculty member that a department has identified to be the lead on remote learning, and that this senior remote learning TA can help coordinate with that faculty member remote learning issues across the department. We've also authorized departments, should they wish, on a case-by-case basis when it makes sense for the individual graduate student, and if they have the ability and the department wishes to do this, to consider over appointing a small group of graduate students who have the capacity and skills to assist with remote learning. And again, this is a remote learning oriented TA-ship that would report jointly to the faculty member and the senior remote learning TA who are responsible for remote learning. If you have any questions about that, ask your department. We can certainly help clarify this, but I want to stress this is on a case-by-case basis, and departments have the authority to make that decision. The next bullet is what I call the no pressure rule. Basically, graduate students shall not be considered as essential research staff in labs. We are trying to protect graduate students from being told that they must enter into research spaces to do essential research work on behalf of a lab or any other sort of situation. We've tried to be very, very clear with faculty and PIs about this. PIs should not be expecting students to be in the labs. If, again, there are any concerns, you can raise those concerns directly with me through the Graduate Dean email account. Of course, Rachel Flanagan, your GSA president, is always happy to receive these concerns, and she and I will stay in touch about anything on this front. Finally, I'd like to say, certainly there are some of you out there as graduate students who need to finish experiments so you can make degree progress or finish your degree. We understand that, and we just want to make sure that if that's your particular situation, that you run this through your faculty advisor and your department first and foremost, and that we collectively work with the Vice Chancellor for Research to figure out appropriate steps for your unique situation. Again, if there are any questions, you can contact the Graduate Division for assistance on this. Next slide. Okay, I'm going to turn it over now to Tiffany Swiderski, the Director of Financial Support Unit at the Graduate Division, and Tamara Shops, the Assistant Dean.
Thanks, Jim. I just wanted to quickly share with students that there were an announcement was sent last week to all graduate students to encourage them to sign up for direct deposit, and specifically drawing attention to the fact that there's 2 different types of direct deposit at the university, and most graduate students will probably need to sign up for both. And so if you haven't yet signed up for employment and payroll direct deposit, as well as stipend and financial aid direct deposit, there are the links there on the slide, and we encourage you to do that as soon as possible, so that you can have uninterrupted checks coming, or uninterrupted payments coming from the university instead of paper checks that are hard to route as we're all in different locations now. And then also just noting that there is guidance that continues to come out for academic student employees, recognizing that many of our graduate students are also employees of the university, just to encourage you to check our Graduate Division website for resources as you have questions that come up or anything related to your academic employment. And I will hand off to the Student Life Group.
All right, thank you. Good morning, everybody. My name is Patty Mahaffey, and I work in Student Life. Can we go to the next slide? So we know some of our students may be disproportionately affected by the impact of all these campus life and academic changes, and that could affect your access to basic needs, which are really the most essential resources required to thrive as a student, including nutritious food, stable housing, and financial wellness. We have a vast array of robust basic needs services on campus. If you have found yourself having lost employment due to the coronavirus, you may be eligible for financial assistance. And we invite you to visit the Basic Needs website and complete the lost wages due to COVID-19 online form. And we will work with you to get you connected to applicable resources. And that is open to students that have jobs both on and off campus. Can we go to the next slide? All right, so the Triton Food Pantry remains open with daily hours every day with the exception of Friday. So I invite you to check their Facebook page for hours. The Basic Needs Hub is also open for very limited hours on Wednesday and Fridays from 12 to 2, and is also offering a concierge service for any personal hygiene products that folks might need to pick up. You can just set an appointment, and I invite you to email the Basic Needs Hub at basicneeds@ucsd.edu, or you can call them directly. We will also be starting a mobile food pantry over in graduate housing to make accessing the food pantry just a little bit easier. So be on the lookout for information about prepared meals for grad students, as we'll be partnering with the Food Recovery Network on coordinating some food distributions. Can we go to the next slide? And then finally, in collaboration with Transportation and Parking, we're going to continue to operate the grocery shuttle program that brings students to local grocery stores to get food and essentials that has been super popular with students this year. We're going to run this on a limited basis, so it's only going to go every Tuesday from 10 to 4. It's a pickup will still be at the Mandeville Loop. Space is going to be very limited though, because we will be employing physical distancing on the shuttle. But we will continue that program as well. And I will turn it back over to James.
Thank you so much to our wonderful panelists for the time and energy and dedication they've put into putting all this information together. We have about 20 minutes left remaining here for questions. We do have a couple of questions already in the Q&A box. If you have questions, we encourage you to type those into the Q&A box. There's a question that I believe our two doctors can answer. It has to do with what makes the COVID-19 so much more threatening than other forms of the flu, as commonly experienced every flu season, and which also cause death. Is it primarily the mortality rate or the transmission rate? I'll allow the doctors to respond to that question.
This is Dr. Schooley. It's a combination of both. In the case of influenza, all of us have had experience with related strains of flu over the course of our lifetime. So there is already a built up level of immunity in the community to influenza. And when we start becoming exposed to new strains of influenza each year, the new strains of virus faced resistance from the immunity in the population, so that more and more of the interactions become dead ends for the virus, and it doesn't get transmitted to people who aren't currently infected. In the case of SARS-CoV-2, there is no immunity in the population from the past, and so each time the virus finds its way from, in terms of contact, from someone who's infected to someone who is not, that's a potential transmission opportunity for the virus. And this absence of herd immunity allows it to spread without any resistance in the population. As to the reason that it's more serious than influenza, most strains of influenza are strains that have receptors that grow best, that have receptors in the body located in the nose and throat. That's why we have runny noses and we have sore throats with flu. There are some forms of influenza, the so-called bird flu, in which the bird flu, that strain of influenza has and that's why bird flu is one that we are concerned quite a bit about in terms of causing severe disease. SARS-CoV-2 is just like bird flu from that perspective, in that it uses receptors that are deep in the lungs, and therefore it grows in the lungs and causes pneumonia rather than a runny nose and a sore throat. So The two answers are there's very little immunity in the population, so it can spread quickly once it gets going. And when you do get it, it grows in the lungs and causes pneumonia rather than a runny nose and sore throat.
Thank you so much. I'm going to turn it over to Associate Dean Judy Kim to answer a second question that has to do with defenses.
Yeah, thanks, Jim. There was a question in the Q&A which had to do with candidacy and application to candidacy, and I wanted to bring this up. This one in particular is probably for the master's application to candidacy. It's due next week, and I am having a hard time finding my 2 other committee members. What if I cannot find people? Oops, another question just came up. What if I cannot find people to commit to this by next week? This is, thank you for asking this question. This is really a question about deadlines. And in this particular case, we did set a deadline for the application to candidacy a week. If you need more time for this application or this deadline or any other deadline, work with your graduate coordinator, because we will be accommodating because we understand the challenges that everyone is facing with communication, getting in touch, securing members. So we are going to be flexible, but work please with your graduate coordinator if you do think you are having problems beyond the already extended deadline.
Thank you, Judy. Just keeping on the theme of defenses, and then we'll go back to another question in the log. There's a question: if the campus reopens, will defenses be allowed, not required, but allowed to take place in person as long as social distancing policies are followed? It's a great question. And as you might imagine, we just don't know what the immediate future holds in terms of resumption of normal in-person meetings. I think the best thing for us to do right now is to go ahead and assume that through the remainder of this academic year, the current policies that are in place for defenses to occur remotely are what we are going to do. Of course, as the campus gains clarity in the near future, we will update folks. So that's the best way to think about it. Okay, I'm going to turn one question back to Dr. Sosha, which has to do with access to SHS services. Let me preface this though. A couple of you have been very good about raising some questions about joint doctoral program students. Even before this crisis, you were in conversation with us. And just to reiterate for everybody on the webinar, joint doctoral program students, it's a tricky situation because in many cases, if not all, those students are registered at San Diego State University and therefore not paying technically fees as UC San Diego students. I can't provide definitive answers on this webinar about changes to those policies because it's a much larger issue than what's presented right now in the current COVID crisis. But I want to turn it over to Angela just for a moment for clarity about whether any student can still contact SHS for advice or testing.
Yes, thanks for this clarification. And it is true that the student services fees are basically a large part of the funding totally for CAPS and a good portion for student health services. So at this time, the CAPS is only for those students who provide or pay student service fees. And my understanding is that the joint doctoral students with San Diego State do not pay those fees. For the student health side, we do have a process to bill other insurances, and this is where the student from San Diego State, where the fees are going through San Diego State, should first, I believe, best course is to go to San Diego State to see what their options are for their student and their student health services. That would be the best thing to do, since that's generally where their support will be found.
Thank you.
If you get any help at San Diego State, then reach out to one of us individual. We'll see if we can make an exception. But the real path is to go where they are paying their student fees and their student health is supposed to be provided.
Thank you. And while we have the two doctors on the chat, there are questions about the precautions being taken for protecting graduate students who are living adjacent to the buildings leased to the county. Will we be able to leave our units once they arrive? Can we open our windows? Will the density of patients nearby increase our chances of getting sick? It'd be great if you can answer those questions.
First of all, we're not certain that we're going to need this space. We hope we don't. This is part of the effort to be as ready as possible in case we have a New York-like situation. As I said earlier, I'm hoping that the relatively flatter trajectory here reflects the earlier intervention that was taken here in Southern California and keeps us from overflowing to places that weren't developed as hospitals. If we do go into a situation in which people are in an adjacent building, they would not pose a risk to people in the next building, even with windows open. The virus is one that is spread on fomites, things you touch, contacts between individuals, and we obviously wouldn't want to have graduate students going in and out of the buildings where patients are housed or vice versa. So the short answer is that we are hoping that we don't need to use these, but if we do need to use these, we think this can be done quite safely and think it will contribute to decreasing the overall impact of the virus on our population, which is the only way we can get back to normal. We have to have a place to put people safely, and we have to have a place to put them where they're not going to be in contact with in close enough way to transmit the virus to other people in a way that continues to propagate the epidemic in people who are still sick but ambulatory. So I certainly share your concerns. I'd be happy to move into the graduate student housing if they're, from the infectious disease perspective. But I do certainly understand your concerns because this is a concerning time and it's a very anxiety-provoking situation. But building to building spread is not what we expect to see here with the types of buildings we have in San Diego.
And this
Great.
is Robert Frazier as well. The question did point out that these will be separate buildings. So the idea of student occupied buildings are not the same as the proposed county building. And so just to be clear to all the folks that are on the webinar, there will be no commingling of isolated individuals and non-isolated individuals.
Correct. And just to confirm that our students who need isolation, we want to provide that service for any student who may be unfortunate and acquire this virus. And we know that that's going to happen through nobody's fault because of the prevalence of the virus throughout various communities. That we are providing the isolation housing for those students separate from the building that involves the county, because that affords our students the housing and dining food support, as well as we provide the medical support through student health services. So we're not going to put our students who need isolation in the county building. And those students who are in the isolation process have been, are given very clear instructions about staying within their room, and we do everything so they never have to leave that room. So that creates no risk to the other individuals within those buildings.
Thank you. We have a question in the log that I'm going to ask Vice Chancellor Satterland to weigh in on. The question has to do with remission of campus fees, for example, recreational center fees and fees for other services that are not available this year.
Hey, good morning. I hope you all can hear me well. I'm going to transition from my phone to my laptop, so pardon me.
Okay, so I appreciate this question. I want to reiterate that the campus remains open, and in our transition to a virtual student experience, we have taken to heart the frustration and difficulty of the current circumstance. We are in the process of moving several of our services to an online virtual model. You'll find recreation has fully moved a number of its services online. as has student health and counseling and psychological services. Our student retention and success and student life functions are in the process of moving a number of student services remotely and virtually, and we'll be kicking off a student success podcast that also serves graduate student needs and interests in the next week. We also want to reiterate that we are following guidance from the UC Office of the President that tuitions and fees will remain steady. I also want to reiterate how important this is in that campus student service fees and activity fees support infrastructure, debt service, staff who are deeply dedicated to our success. All of these costs remain the same, and you have our commitment to ensure the best student experience during this unprecedented time as possible.
Okay, thank you very much. There's a question about a phenomenon called Zoom bombing, which everybody maybe is beginning to hear about. I'm going to invite Rachel Flanagan to go ahead and answer this question, and I can weigh in if there's any additional issues.
Hi, so as far as Zoom bombing goes, I think that's something that we're all really cognizant of. And I know that Zoom released an update, I think literally this week for security around the software, but I strongly recommend some of the Zoom trainings that I think they're available through the Keep Teaching resource online. But if you use the settings, you can do things like have a waiting room, require folks to sign in. You have the power as host to mute participants and to keep people from putting inappropriate things in the chat as well. So strongly recommend checking out some of those resources online. Another little tidbit about Zoom bombing is I know some folks on campus have experienced this, and so I know that there's a lot of work going on around how to address that and what solutions we have for kind of those problems.
Thank you, Rachel. And both the Commons as well as the Information Technology Services, ITS, have detailed instructions on how to control all aspects of Zoom to help prevent against the Zoom bombing phenomenon. Thanks for the question. There is a question about whether there will be more guidelines on how students who need to graduate will be able to come to campus to do more experiments. And again, if you have a particular situation as a graduate student where you desperately need to do more experiments or more work on your research in order to finish and make progress on your degree, the proper way to do this is to first work with your advisor and your department to figure out a potential solution, and then to work with the Vice Chancellor of Research to figure out a manner in which this work can be completed. If you have any questions, of course, you can contact the Graduate Dean's Office and we can help walk you through that. Another question pertaining to student health services: if a student who lives off campus is decided by student health services to be isolated, will the school take the necessary measures to isolate them in one of the dedicated units for isolation, or the isolation units, are they only dedicated for students who live on campus? I'm going to first direct this question to both Angela and Robert Frazier, Angela Sosha and Robert Frazier, and then Rachel Flanagan can weigh in as well.
No, currently the students who are off campus and they need to be isolated, they are giving instructions on how to isolate in the residence that they have off campus. They are not moved on campus.
Robert Frazier, I really don't know what else I would add to that. That is the situation, so nothing more to add.
And it is possible to isolate yourself in a residence. It is a little more complicated if you don't have private bathrooms and bedrooms, but this is what individuals throughout the community actually are tasked with doing, or that's how they have to respond.
it appears that there is another question pertaining to JDP students and their access to student health. And I'm going to invite Dr. Sosha to take a look at that question and see if she can provide further clarity.
Sorry, this is Angela. I temporarily lost the connection. I don't know if others did as well. Was there something more I needed to answer?
Let me read the question, Dr. Sosha.
Sure.
It's another question from a JDP audience. Am I correct to understand that JDP students, that is San Diego State University registered students living on the UCSD campus, should first contact SDSU for medical support should they experience COVID-19 symptoms? Then, and only if we don't receive support from SDSU, should we contact UCSD?
Okay, thanks for that. I did not realize we actually had some of those students living on our campus. In this situation, if you are living on the campus, I would actually call student health, let them know your situation, and we will figure out a way. And it's a COVID-related issue, not for all healthcare, but a COVID-related health issue. We will help you through student health. That way, if you need to move to isolation, we can help you with that entire process. So thanks for bringing that up. I didn't realize we had students living on campus in the joint program. So we'll give you help there through student health. Just clarify it, let them know that Dr. Sosha said it's okay, and we'll get you taken care of. I also think as this progresses, we'll keep our eye on the off-campus student situation because if they were to be told to go to the county housing rather than to stay in their own campus apartment, off-campus apartment, we might consider bringing those students into the student isolation process. It just hasn't come up until now. So we'll keep our eyes open on that. I want to speak to the current process, which currently on-campus isolation is for those that currently have on-campus housing.
Okay, we have about 30 seconds remaining. I just want to use this time to thank the panelists for joining us in this informative webinar. If there are any questions that linger or you think of after the fact, please do feel free to address those questions directly to the graduate dean at UC San Diego email address, and we'll do our best to answer your questions. Once again, this has been recorded, and we'll be sure to post this recording in due time after this webinar has been completed. Thank you once again, and we wish you good health. And we know this is an anxious time for all of us, and we appreciate everybody hanging together. Thank you so much, and goodbye.